Good morning. This is Dr. Rajesh Mehra from Chantilly Family Practice in Chantilly. And I'm honored to have with me in our studios three very prominent urologists from the metro area. Being that this is Prostate Cancer Month, they're going to enlighten us on different topics regarding prostate cancer. My first guest happens to be Dr. Mark Bilowus, who you have seen before. Dr. Bilowus, tell us a little bit about HIFU, which we've discussed before with you, but in general, how do you decide what of the many treatment options is going to suit which patient?
That's a very important question, Dr. Mehra, because there is no one treatment for every patient. More aggressive tumors behave more aggressively and require a more radical treatment. Tumor may behave as a tiger, and for that patient who has an aggressive tumor based on his pathology report after the biopsy, they may require extensive radiation therapy as the best choice as possible, or cryotherapy, whereas a tumor that behaves as a pussycat, which is a low-stage, slow-growing tumor in a small area of the prostate, may be more amenable to a focal treatment, such as focal cryotherapy, focal high-intensity ultrasound of the prostate gland. All those can be done. So a patient who was identified as a low-grade, low-stage tumor means a slow-growing tumor in a small area of the prostate gland that it has not spread is most amenable to high-intensity focused ultrasound, for example. That will preserve the patient's erectile function so they can lead a normal, healthy, active life, and also will protect their incontinence
so
concern.
Less side effects.
Less side effects,
to
certainly.
A lot of other things. Excellent. Well, the other thing I wanted to really ask you is, it sounds like each patient, as always in medicine, needs to be individualized depending on what the options are. Now, all these options are amenable or available to most urologists in the area?
All the options are available. Those who have taken the initiative to do advanced training in the most modern techniques, such as HIFU, and several of my colleagues here today have, it's something that you have to pursue, and if you want to stay on top of the latest treatments in the field and be able to treat all types of prostate cancer, you have to be the complete urologist and surgeon and be open to all types of treatment for the benefit of each patient.
Exactly. You got to keep up with what's going on. Well, again, you've been very helpful. I'm going to look forward to speaking to our other specialist in this area who will be coming soon to talk to us about prostate cancer. Thank you.
Thank you, Dr. Mehra.
Thank you very much.
It's a pleasure.
Good morning. This is Dr. Rajesh Mehra from Chantilly Family Practice in Chantilly, Virginia. This month being September, the month of prostate awareness, we have in our studios this morning a distinguished urologist, Dr. Lloyd Glover, who's been here many times before with us. Welcome, sir.
Thank you, Dr. Mehra.
Thank you. Tell us and educate us a little bit about some of the newer things that have come about in treatment of prostate cancer. Usually surgery, radiation has been the mainstay, but now we have newer techniques.
We do, Dr. Mehra. The problems with radiation and with surgery is that sometimes they have very bad side effects, urinary leakage, incontinence problems, impotence, bleeding, etc. And it's really encouraging to have two new treatment modalities that are so much safer and equally or even more effective. The techniques are cryoablation of the prostate, where we put some needles into the prostate and freeze it into super chilled cold and kill the cancer in that fashion without hurting anything else around there. Sort of like the dermatologist does. If you go to the dermatologist with a skin cancer, he'll frequently freeze it as his treatment of choice. The other newer technique that's working very nicely is something called high-intensity focused ultrasound, or HIFU, where a powerful ultrasound beam can be focused right into the cancer and heat it up to the point of just short of boiling and kill it instantly. And these are two excellent new treatments that are working out very well.
Now tell me something, when a person has been diagnosed as prostate cancer, how does one decide then which treatment modality you're going to go with? Because there's choices now have become very big.
The good news is that we have some better choices. These two techniques that I just mentioned are so much safer and without problems of the urinary leakage and the impotence. But some individuals might prefer to have the old surgery, or might prefer to undergo radiation and take their chances on the radiation problems. But it's nice to have something that is safe and equally effective.
Equally as a, so does age and the complexity of the cancer determine, like if it's advanced versus just starting out?
Well, if the cancer is advanced, they're probably not going to be a candidate for any treatment for cure, like surgery, cryo, or HIFU. We want to catch these cancers early before the cancer has escaped from the gland and spread throughout the body. And that's what we're focusing on here in Prostate Cancer Awareness Week, sponsored by the American Urologic Association for several years. Widespread screening of patients, of men who may not see a doctor otherwise. We are able to get them in at these screenings and check them for early prostate cancer.
Right. That's now one of the questions patients always ask me is, how much is it going to hurt? Are these procedures, especially the newer techniques you spoke about, are they done as an outpatient, or are they done in a hospital setting?
Well, that's one of the nice things about it. Each of these procedures take about an hour. They're done as an outpatient. The individual doesn't even really need to stay in the hospital afterwards because they're so safe. Once they wake up from the anesthesia, they can head home and take it easy for a few days, but be up and about and be doing very, very well.
Excellent. My last question about the high intensity frequency, the HIFU as it is called, unfortunately it's not yet FDA approved, but it's still being done in surrounding countries and in Canada?
Oh yes, quite a lot of people are choosing to take a vacation in Cancun or Bermuda or the Nassau or Montreal and have their HIFU done there. The procedure is so safe that this is working out very nicely for many people. We're participating in large trials of HIFU for the FDA, but unfortunately these things seem to take forever, and if an individual has cancer today, he probably wants to think about his options today.
Excellent. Well, you really enlightened our audience regarding all of this, and I appreciate you taking time out of your busy schedule to do this, and we welcome, as always, to come and keep educating our audience about these very interesting health topics. Thank you so much.
Thank you, Dr. Mehra, and it's a privilege to address your audience.
Thank you, sir. Good morning. This is Dr. Rajesh Mehra from Chantilly Family Practice in Chantilly, Virginia. This month happens to be Prostate Awareness Month, and I'm honored to have with me in the studio three very good experts regarding this topic. You heard and saw earlier Dr. Mark Bilowus. Next we have with us Dr. Guleria, again a very prominent urologist, who's going to give us some more details about prostate cancer. Dr. Guleria, prostate cancer, is it very common? Give us some figures about how common is it?
Well, prostate cancer is actually the most common cancer in men in the United States, behind skin cancers. So over 240,000 men will be diagnosed with prostate cancer this year.
That's a lot.
That's a lot of prostate cancers. Fortunately, for most men, it's slow growing and very treatable if caught at an early stage. Over the past several decades, things have changed in terms of diagnosis. PSA became a test available in the early 1990s for screening for prostate cancer. So that allowed us to find these cancers earlier and therefore bring them to treatment. Much like breast cancer, in the early days of breast cancer therapy, we were very aggressive with surgery, radiation, chemotherapy. Now those things have become much less common, particularly the radical mastectomies and the more aggressive therapies. With prostate cancer, we've also come a long way. We used to do radical prostatectomies as our mainstay of therapy, aggressive radiation of large amounts of the pelvis, which resulted in significant side effects. So now, as Dr. Bilowus alluded to, we have more focused therapies that can treat just the prostate.
Target that area.
Exactly, because we want to minimize the damage to surrounding structures, minimize the effects on the patient's life, because the cancer itself may not be symptomatic and it may not even be lethal, so we certainly don't want to induce injury and a new problem for somebody who doesn't have a problem. So therefore, things like HIFU, cryotherapy, which now can be targeted and very focused on part of the prostate or the entire prostate, but certainly exclude things like the rectal area, the bladder, and the nerves that regulate erectile function. Those treatments really give the patients a lot of options for therapy.
So the theme I keep hearing all of you great experts sort of talk about is that the newer therapies are more targeted and have less side effects because one doesn't need to radiate the whole area and cause all these different things that are going on.
Exactly. And the problem with things like surgery and radiation is some of those damages that occur can be permanent and a lifelong problem for the patients, particularly incontinence and impotence being the most common things.
Excellent. Well, I know this has been very enlightening to our audience, and I know that we're going to have a lot of questions generated. So keep those emails coming, and we will try and answer those next time we have Dr. Guleria on the show. Thank you again, sir.
Thank you, Dr. Mehra.